Okay, now it's recording.
Okay. Okay, so how about you just welcome?
Hi there. I'd like to welcome you to our Zoom class today for unexpected childbirth. My name is Charlene Campbell, and I'm with my colleagues Faline and Nikki, and we are going to have some fun today. We're glad you're joining us, and if you're watching this later, we hope you enjoy it and share it with your family. So I'll let Faline and Nikki say hi, and then we'll get started.
Nikki?
Hello. It's good to have you with us.
Hello. And we're going to start with a song.
I thought we'd start with the Strong Woman song.
Fantastic. Okay.
And even Nikki can use those words.
I'm going to try to screen share. I'm not really experienced at this, but I'll be doing that.
Okay, and then I don't know if you want to draw it. Now there's some sticks here.
We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun. We are sisters on a journey, singing in the sun, remembering the ancient ones, the women and the wisdom, the women and the wisdom. We are sisters on a journey, watching life unfold, sharing warmth of heart and hands, the knowledge of the old, the knowledge of the old. We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun.
I will say a prayer to start our circle. Our dear Father, we're so grateful for this beautiful circle of sisters and brothers who are watching this. We thank thee for this opportunity to share our love, our care, our talents, and our knowledge and wisdom with those who are in the place where they're needing this information or where they just want to know this information so they can be of service to others in the future and be prepared to be an instrument in the hands of our Father and our Savior, Jesus Christ. We love them. We love all of you, and thank you for coming. And bless each of us this day with the Spirit of the Lord to guide us, to enrich us, and to teach us. In Jesus' holy name, I pray for all those in need of help today who are suffering. May they feel the Mother, good wisdom, and the Father in his holy knowledge and love, encircling them in peace and in fortitude and in strength. And may we have that Spirit with us today also. In Jesus' name, amen.
Amen.
Okay, so welcome everybody. I don't know if anyone's here or not yet, but if you're not, it's okay because it seems that a lot of people watch these later. I love that song because it really says what we're doing here. And I'm I'm really happy to be part of this ministry of teaching people how to reframe childbirth so that the fear and the doubt and the potential for more suffering is released and compensated by this knowledge that helps us to be able to act without fear and to act with practical tips and practical ways that are just caring and supportive of women in unexpected circumstances. And whether that is because of a pandemic like we're in now, where lots and lots of women are moving into home births. The midwives are really, really busy in Seattle and in Rexburg and other places. I've been talking to them. And so this is just going to get more and more and more where women are really realizing that the hospitals are not the safest place to have a baby. We already know from all the studies that hospitals have a higher infection rate than home births, and the studies are conclusive on that. So the only difference between hospital and home birth for low-risk women is that there's a higher infection rate in the hospital, and that was even before a pandemic. So we know that it's only the knowledgeable people are going to start choosing out of hospital birth, but not only that, there may be times where they don't have a choice and they don't actually have enough care providers to cover. Now, we had a situation like that in Seattle where there was a large group, I think 72 midwives in the state at the time, and we were all called together at one of the Ebola crises. And we were told to be on alert so that we could respond quickly if need be in a situation where there was a need, and they had to send us out to do they call it in-place birth. So anyway, I thought we would start by following we've got a little outline here, the things that we're going to try to cover today. And we thought we would just go over them a little bit today before we start, so that you have just a little bit of an idea. So the first thing I'm going to talk about with Faye here, Nikki's filming us, thanks Nikki.
Yep.
Is the long labor. I had a really sweet little friend, a daughter of, well, I helped catch this little sweet Emily, and she's coming today to watch this. So that's going to be great to see her. And her mom is one of my best friends. So it's amazing. She's having her second baby. But she specifically contacted me to let me know that some of these issues are some of the things that she had with her last labor. So we want to make this as practical and helpful for you, whether you're going with a midwife or in the hospital, or whether you're going to be helping somebody else. I mean, it can go for anything, this information. It's great for just practical information. So we'll start with long labor. Let's see what we have to say about long labor. I'm going to have, Faye, do you feel good reading?
I'm fine.
Yeah. Okay, I just thought Faye will go over some of these, and feel free to stop and explain.
Okay.
Okay.
Or interrupt me.
Okay, I will. I will.
Long labor is associated with poor positioning of the unborn baby within the womb and results in little progress being made through the labor process. Once the baby's in a better position, labor will progress much more rapidly. The following things will help the unborn baby get into the optimal position. So the first on the list is visualizing the baby in the optimal position. You don't need to know what the optimal position is to be able to visualize a baby getting into just the right position for itself.
So the optimal position is when the baby is, this is tied around the baby because we don't have a little attachment, but that's okay. The optimal position is when the baby is with the head to the front this way, the back to the front rather, tucked nice down, tucked with the head chin to chest, and then the feet are usually kind of, bent. But that's the optimal position, but with the body straight up and not with the head tipping one side. Like if the head is tipping to the side or that side, or if the baby's like posterior, or if the baby is, sometimes they can even be sideways transfers. That's very rare. But all of these things that we're talking about can help anything, really. So, okay.
Yeah. Most of the time, you're not going to know exactly what position the baby is in. Even the most experienced midwives can sometimes have a difficult time knowing just how the baby is, especially if the head's just off a little bit. And since we wouldn't be doing any internal exams, you wouldn't have those clues to help you either. One of the clues that you can have that wouldn't be too difficult for a novice would be if you can feel a lot of action at the front of the belly. If you imagine a baby here, a baby should be in this type of position within the belly. There's not going to be a lot of action coming from this back, but if the baby is posterior, or what's known as sunny side up, there could be a lot of action here at the front of the belly, where the arms and the legs and everything would then be. That's one of the ways you could recognize.
And I'd like to just add something to that, Nick, Faye, and that is that if the woman's laying flat on your back, another thing that's really typical, is that when that baby is inside with the back down, it almost makes like a dip here in the middle, a little dip. Usually you'll have like a big full round belly when the back's in the front. But when the tummy's here, it dips in the front, when she's on her back, usually.
And as Char was going over earlier with us, babies want to lay in a certain position. And if the mother is upright, then that position is going to be like this.
If she's sitting forward more, see how I'm sitting forward with my pelvis? I'm not leaning like this. I'm not in a car seat leaning back, or in a car leaning back.
Yeah,
I'm not on a reclining seat or a couch. I've got my spine directly over top of my sit bones, and I've got my head, in a vertical angle with my body. And so it's not like I'm going to go and make a really strong pelvic tilt this way. No, I'm not going to try to tilt my pelvis in this way. I'm not going to stick my bum out, but I'm going to hold my rib cage over top of my pelvis here in a neutral position. But my chest is going to be slightly stuck out, not caved in like that. My shoulders are going to be back and my head will be up straight. Posture is extremely important, and can't say enough about posture.
A working active posture is going to help that baby be in an optimal position.
And then we're going to talk about some other really cool things you can do, like daily crawling on hands and knees on the floor can be really helpful for not only rectifying a malposition, but just maintenance during the pregnancy so that you don't have a malpositioning issue.
After visualizing the baby in an optimal position, which we've just gone over, encouraging the mother with quiet, trusting attitude and words. And the next, trying position changes.
So can I interrupt here for a second? Okay. So give us an example of optimal, words and things that they would like to say.
So this is long labor. Mom's been laboring a very long time.
I'm going to put the baby in this way. Oh, when's it going to be over? It hurts. My back hurts so much. Oh, can I help you? Oh,
does that feel good?
Yeah, that hurts. That helps. Oh, can you push harder? Just a little bit lower than that.
Right here?
Yeah.
Okay.
Oh.
Whatever feels best to you. I want you to trust yourself and trust that baby.
Oh.
Go ahead and
Okay.
get in touch with that baby.
Okay. Oh, that one's over. Oh my goodness, that felt so much better than the sitting on my bum.
You're doing so well.
So you get the idea with that, eh? Like I was sitting here and it was hurting because why? well, I've already got this bone pushing against my spine. I've got this pushing against my spine, and I don't need anything else. So if I'm going to go down, what's going to happen is that's going to suddenly just take that load off. And then, you know, babies are heavy on their back. They're heavier on their back than they are on their tummy. So their natural inclination, if you're on your hands and knees enough and you're rocking them, is to want to go into the back position there with your belly, with their back to your belly, which is where they're supposed to be. And you can talk to them and tell them to turn around too. Yeah. Because babies hear you.
And as you're talking to mother and encouraging her to trust herself and to reach into herself, to know what to do, how to move, how to be, that she has a connection with that baby. And the mother may never have heard that before, that she should be trusting herself through this process, and that she is the expert.
Yes, I think that's, I used to encourage mothers to write a letter to their baby during their pregnancy, because I really felt like it helped with the bonding process right at the birth. So anything you can do to encourage moms to be close to their babies.
To make that connection.
Yeah. And then having routines, like it's like daily self-care, vigilant routines that woman does. She, like, I've worked with so many women over the years, so many. And the ones that can change their lifestyle and are really committed to changing it are the ones that are going to have different outcomes for the births. It really makes a big difference. So they start really taking care of themselves. They start really honoring themselves, honoring their womb, saying no to things that maybe are stressful for them, or to doing so much. It's the doing is the masculine energy. The being is the feminine energy. And when you're pregnant and you're going to be having a baby, and the closer you get to that, be and be. And that's really what you need to be, is just yourself, and not be thinking that you have to do a bunch of stuff. The other thing is to have routines. Like I said, with crawling, with swimming can be really good. I think a 30-minute walk or 2 15-minute walks a day is a good plan for your entire pregnancy. Outside in nature, where you're actually appreciating things and not too distracted, but you're able to relax and just walk at your own pace and enjoy. Did you have anything?
I think those are great advice. And I know that one of the ways that, and I know it sounds silly because there's that thing going around about, you know, a shower shouldn't be self-care, but it is. And yes, to be able to have that moment.
Water pouring on your body is so cathartic, let's face it.
Have everything else stop and be able to get in touch with yourself. Yeah. And, you know, and you're in a little room. And the door is locked.
Speaking as a mother of 8 children, very wise woman.
Just to have those 15 minutes, you want a nice long shower, you take that nice long shower, and
I think doing for yourself, not necessarily indulgent things like eating tons of chocolate or watching tons of shows or whatever, but indulgent in the sense that you're indulging in the things that you know really make you feel happy, feel joyful, and feel energized. Where you, and so that even might be journaling. If you're not feeling well, or you're feeling irritable and you're starting to feel triggered, that is a clue that you need to pull back and internalize that energy and process the energy, not out here in your environment, but in your private sanctuary of your shower meditation. Okay.
So the next thing that we started talking about was position change. So encouraging a woman to be changing positions without controlling her, but encouraging her. Would you like to change positions? What feels good? Where would you like to go? I can help you. We can do that. And to be able to change positions. If you have a mother who is very far from trusting herself, then you may need to do more direction as far as, okay, it's time to get up now, we're going to move. But hopefully she's been able to come through the process in a long labor where she is beginning to trust herself because you've been encouraging that.
Right, and can I make a comment too, that if it's you yourself and you haven't been used to trusting yourself, or, you know, you had a labor before where you just didn't feel super empowered and you didn't really know how to mitigate the discomfort that you were in, or you felt like your labor was just not progressing the way you had hoped. One thing that I really super highly recommend is learning to ask yourself, and you're talking to your physical body. So, you know, you ask the physical body, what do you need? What can I do for you? And then you listen to the answer, and it might just come in a flash where you see yourself going into the bathroom. And this just came into my mind, so I'm going to say it, okay? Now, this is a really good position for any malposition. So, and I've seen a lot of babies come out in this. I don't know what it is. I think the bathroom kind of signifies privacy. So you go in the bathroom, you put a big pillow on the back of the toilet. You sit this way with your face to the back, to the wall, and you lean on that pillow with your body, you know, straddling the toilet. And then somebody can massage your back or whatever in that position. And if you can stay there for a while, things can really happen. Things can really happen. And like we talked about last time, sometimes when the head is in malpositions, it can mean that the cervical lip that's over the baby's head, or that the baby has to pass through. You know, the cervix is kind of the entryway out of the vagina, or the exit way out of the womb, however you want to look at it. But anyway, as it's opening, sometimes it can get pinched. If the head's slightly tipped or cockeyed that way, then sometimes that lip can get pinched. And then those forward leaning positions can be really good. Let's show a couple of forward leaning positions that are really good. We've got a ball here. Do you want to demonstrate on the ball? And then I'm going to do, I want to just throw in rebozo here because I feel like we can't not show rebozo because it's so important to you. Now, she's sitting on the ball, but really
sitting on the ball. I'm not doing forward leaning it, but doing figure eights on that ball is so nice, as far as like when you're in labor and you just are trying to dance or wiggle that baby out, and you're just going to just allow that to take the pressure off your legs. And move around.
And that's where asking the body what the body needs, and not having some kind of conformed idea in your head about what you think has to happen.
Yeah.
It's really good, because you can have ideas like this, but then I've actually seen and witnessed women who just instinctually move their hips in certain ways, and it really does facilitate the delivery. Now, another thing we could do is, we always want to be mindful of the mother's knees. So let's fold this up for Faye, and then she can kneel, and then she can see if that would be a height that's good for her. But it might be too low.
Yeah. So I might want another pillow on top of this, or just on a pillow.
Let's put that on. I have an idea what we could put it on. Well, is this too stiff to put on? Okay. So whatever you can find at home. I really like the kidney bean balls. I find them actually, well, they're both good, but I find them even more useful than these ones. So you can buy those online. They're like a kidney bean. I mean, you can bring that to your own birth if it's your birth, and you could have it in your car or in your house if you're helping somebody.
And a lot of hospitals have those available now too.
Oh, cool. And then we'll just do a little bit of rebozo in that position. Like, really, the hips are moldable, right? So we know that the hips, the cartilage builds in the last few weeks of pregnancy to the point where this is a moldable structure. It's a movable, stretchable, movable structure. And as you move, as the mother moves and changes position, the pelvis moves. And then of course we know the baby's head is comprised of all these different bones, and they actually have these separations, the suture lines, and they overlap. These two bones could overlap that much, but they'll all go back to normal after. So just remember, this is a process of coordination of three, like the baby, the mother and the pelvis, like the mother's whole energy, her pelvis, and the baby. It's all part of the whole thing. So that's why this is so beneficial, because it blesses the mother. She feels nurtured. She feels attended to. Most mothers, I don't think I've ever had one mother not like it in all my time. So yeah, so I don't know. This has been my most successful wrap. This one, jiggle, 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 jerk. Okay, so why do I do the jerk? Well, the reason I'm doing it is because let's just, for example, this baby is not in in the best optimal position. Babies can still come out, we know that. Might hurt a lot, but they can come out. And moms do it, amazing. And I'll give you a little tip. You can get, in Canada, you can buy gravel suppositories, and they're anti-nausea. And I'll tell you, if a woman is really suffering, and that's what I had in my thing, I would put one of those up in her rectum, and it would just ease that whole area. It would analgesize it just a little bit so she could push the baby up. If she couldn't turn it, we couldn't turn it. Anyway, yeah, those are no godsend, but you really need them because it's very rare that a baby doesn't respond, you know, but they do most of the time. Okay, so your baby's not in a good position, and your baby's, I wouldn't say that to a mother. I would say, oh, wait, this baby just needs a little help. Everything we say it in a way that it doesn't make people feel afraid, and it doesn't make them feel worried or concerned. The opposite of some places. Okay, so we will, what we want to do is say the baby's right here. Usually, almost always, babies aren't going to be straight up and down. They're going to be to the left or to the right a little bit. Sometimes they could be right to the side like that. That's not so bad. But if they're like this, then what's the fastest way to get this baby around to the front? Nikki? Which way? This way or this way?
Oh, this way.
It's obviously that,
Yeah.
right? Now, how do we know the baby's in this position? Well, usually on the front, you can hear the heartbeat on one side, but with a baby that's on the back, like this, you can't always hear it as well because it's the stomach that's in the front, not the back. But you'll notice that the legs and the hands and the feet are kicking on mostly one side, and that'll be the opposite side to the side that the back is on. Does that make sense? Mm-hmm. Okay, so then what we're going to do is with this baby,
You're going to have a lot more pain with the mother.
Well, we're
right?
gonna
like that's another way to tell is you'll have a lot of back pain.
Yes, exactly. She'll be, and also the other way to tell if it's a posterior labor. Okay, are you okay staying in this position for a minute?
Just fine.
One of the hallmarks of posterior labor is it starts up fast and furious, but the contractions are relatively short, like 30 to 45 seconds long, but she's acting like she's in transition, but she's just starting her labor. But they're erratic, and they're not lasting a full minute, and they're not every 4 minutes or every 3 minutes. So you just have to wait till that regular pattern comes in. You have to do these position changes and adjustments and help her rest and do the things that she needs to until she gets into true labor, which is true. I mean, not really true labor, but active labor rather. Active labor is when the contractions are lasting a full minute, about 4 minutes, 3 to 4 minutes apart for a full hour. That's called 4-1-1, the 4-1-1 rule. Okay, now we're going to do this. Jiggle, 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 jerk. Jiggle, 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 jerk. Is that okay?
Yes.
Jiggle, jiggle. Okay. Jiggle, jiggle. We don't laugh this much at birth, but sometimes we go in the other room and laugh because sometimes
laughter is good.
Well, sometimes it's really good as long as the mother's okay with it, and as long as she's the one that starts it, then we're okay to laugh. But we take her lead on all things. We do. Okay. Okay, now that's good for that. Okay, that's long labor.
Okay.
I think did we finish?
So we actually just have a couple more
okay,
things. So we've gone
this.
over some of the things that you could do with the rebozo, which we've done some of the other ones too, as far as like supporting the belly. to get the belly up if it's pendulous.
We did that last time, but
yes, we did that last
they
time.
might not have watched that. So can we just,
they can go back and review.
yeah, you can go watch our last one because we showed a lot about that, how to keep the baby and the spine aligned rather than the baby tipping forward.
Now, in a long labor, sometimes moms are going to need to rest so that they have energy for the end.
Mm-hmm.
I've known of moms who will fall asleep and pretty much push the pause button on a labor and then wake up again, you know, however long, maybe half an hour, maybe 5 hours later, ready and back in labor again and just begin to progress. So if a mother can rest, let her rest. Don't make her feel like, or don't, if she's feeling this way, don't make it be like you have to be up, you have to be moving, you have to get this baby out. We got to keep going. No wonder you're having a long labor.
Pressure is masculine and feminine is going with flow. So we have to stay with flow. And flow means we don't pressure. We don't pressure the mother and we let her have her own. But sometimes we have to encourage her quite strongly if she's in a rut. Yeah. There might be times where we really have to say, you know, it's been 2 hours. Let's take a walk to the bathroom. You don't really ask a question if you know something has to get done. Because then if you put it back in her court, you're giving her that, no, you're helping her. You know she has to pee. You're going to help her get up. And you're going to do it in such a way that she doesn't feel like you're forcing it, but it's coming in a flow way with her. But I also wanted to mention something else about that. Can you remind me what you just said so it comes back?
No, I can't.
Can't. Okay. Well, you were talking about, do you remember, Nikki?
I do not.
Oh, the pause. Okay. This is what I was going to say. During the labor, there's a lot of things that you can do to support your body to not have a long pushing stage and to not have a long labor. And I'll tell you some of the things that you can do. Well, one of them is, I just remembered what it was. What I saw, okay, I'm just going to be honest, what I saw, because, hey, I'm a practical person. And I saw a woman in a shower with the husband sucking on her breasts and maybe giving her an orgasm. Now, I'm telling you, that will get the labor to pick up like nothing. It'll get the contractions to start better. It'll get the mother to relax. There's nothing like an orgasm to get things going if she's comfortable and the man's comfortable and they've got the privacy to do it. And anything that it takes to make that happen, you know. But the breast, I also had a little flashback of a time where, you know, I've had a lot of women come to me who have had many, many children, and especially in our church that we belong to, a lot of people have very large families. Don't worry, Nikki, just hold it, it's fine. It's okay. So we sometimes have moms, you know, I've talked to mothers who say that they just couldn't get into labor on their own. Like they would go overdue and they still didn't get the hormones to go into labor. Well, these are moms that are like lots of masculine energy in that family. Like they've got a lot of responsibilities. They've got a lot of kids. They've got a lot of stuff happening. And it's really, really, really kind of, and plus they're worn out. Their hormones are kind of low because they've been doing for so long. So sometimes you'll have a mom like that and she just can't get into labor. So you are going to have to know these things, these little tips on how to help her, because, you know, if the mother needs help to get going, or she might have a stall and need help to get going again. But like I said, and like Faye said, honoring the pause, that's where I think you can do the most good, is not thinking you're in labor before you are. Like that's a really big thing, is that people actually think they're in labor, but they're really in what I would call pre-labor or just building up phase of labor type of thing, you know, because everything is gradual. Everything happens sort of incrementally in our world almost, or most things, not all things. Some things are explosive, but for labor, it's definitely a line upon line kind of process. And so for her at the beginning to not pay so much attention to the pain or to what she perceives as the pain, and to just really be in her own element of her life. Maybe she's making a cake, maybe she's helping with her toddler. Maybe she's napping. Maybe she's spending time with her husband or making soup for after the birth, whatever. But she doesn't stop her life. She just, it's like she's in labor. She might stop for a couple of minutes, lean over, breathe, and then keep going. So that will make it go by so much better. I'm not kidding you. If you stop and go in the hospital and lay down and everybody's looking at you, or even at a home birth, the midwife's there and they set up all their stuff and you're sitting there. A watched pot doesn't boil, okay? So yeah, so we really want to give moms space at the beginning while they're not in active labor. And some midwives even use 412. Some of the really proactive midwives that are really busy, that don't want to be called too early, they'll, unless you're a multip or you've had a lot of babies, like if you're first time or, you know, you'll have to do 2 hours of every 4 minutes, full minute contractions. So yeah, knowing how to time contractions, but don't like focus on it. So the mother's like hyper, like, you know, some of the movies are with, oh, writing down, like, no, you don't need to write down every contraction. You're just getting an evaluation of what's happening. And then you can evaluate it again later when you see some changes or whatever, if you need to, but does that make sense? Okay.
So, as Shar was talking about honoring the pause, did you want to go into the pause?
I do, because I feel like, those are the 2 points I wanted to make. Really, thank you so much, because thank you for reminding me. I would like to talk about the pause, because I feel like it's probably the biggest reason, other than malpositioning, and even with malpositioning, I think it's a combination of a reasoning why people have such long second stage labors in their labors. Now, when you're...
Shar, what is second stage?
Okay, second stage, good question. What is second stage? Second stage is the stage where you push the baby out. It's the expulsion stage, but really you're not pushing your baby out. Mostly your body is pushing your baby out. Your uterus has the biggest muscle in your entire body. Now that muscle, let's talk about it. When that muscle is when you're first in labor, that muscle might not be as thick, right? Let's say this baby's in a decent position, okay, like this. But say this muscle, as the cervix comes back on left head like this, and as it pulls back, these muscles join in and they create more strength with the top muscles and the side muscles. And those muscles push down even more. Now, once that cervix is dilated, okay, this is your cervix, that cervix fully dilated. You see the head's coming down now. Now the head's out, here's the cervix, but the uterus is still here, right here up high, because that's where it was. It was up here, then it came down. Cervix, fundus, or the top of the uterus rather, is right here. Now, that could take 5 minutes. It could take no time, man. Some people, they just come down. Yeah. But it could take an hour. It could take 2 hours.
That slowly to contract down until that power.
Especially if mommy's tired from dilating the cervix, the body just says, okay, we're going to take a break. You're going to get some food. You're going to stop having contractions for an hour. You're only going to have 2 little contractions in there and nothing's really going to happen. And then all of a sudden,
this is not a stall.
Now I want to add something else in here, because I had this impression too earlier, and I want to follow the spirit today as much as I can, because I've been really getting good results from doing that. And that is that, well, here's just a story. We had a birth. It was on the coast of Vancouver, British Columbia, in a place called Seashelt, right on the ocean, and in a cove. And it was a beautiful setting. But this mother, she had multiple little challenges, but the biggest one was that she went into labor. We traveled to her place. I lived over on an island. Someone else lived down on the coast. So we all had to travel because it was quite remote. And we had been there for 3 weeks with her, and she was overdue already. So she went into labor, but then she went out, and so we were there waiting. But it got to the point where she needed to have her baby. She was really big, and the baby was, overdue. And we we tried everything. I mean, we really did. We tried everything. I think her hormones were not totally functioning well, you know. And this can happen. I've talked to people that say, well, I had to go in and get an induction. What are you going to do in a low resource setting in that case? I'm like, well, we're going to find ways to make it happen. And we do. We do it at home. Well, we phoned our friend who happens to be the mother. Oh, I feel the spirit right now so much. Happens to be the mother of Emily, who's going to join us today. Mary. We called her. Now, I can't remember if Emily was her baby then, or if it was one of her other babies. I think it was Emily. How interesting. So she lived way up on another little island somewhere too. She drove down and she said, I'm going to bring my baby. And her baby was like 2.5 months old. We didn't know if this baby would really nurse off of, but this is what we got in our heads, was that we needed a baby. And so she brought her baby. We got the room all dark. She went in there. She brought the baby in dark, and she kind of pulled the baby and she nursed the baby. And then she took the baby out and she laid down. And this we've been waiting for literally weeks. And all of a sudden we hear, what? We hear all this noise, and we go in there and she pushes the baby up. Within like 10 minutes of like after that little nap, after nursing that baby. Boop, take it for whatever you want. If you've got babies around, they're really helpful. Anyway, okay, but we want to wait for that fundus to go all the way down. So we want to be patient and not tell her to push, not tell her to focus on her pushing, not try to say, do you feel like pushing now? Like, no, we just let her spontaneously. If she asks us if she can push, we say, well, if you can't help it, go ahead and push, you know, but if she might just be feeling that because she's been told that when you're fully dilated, then you have to start pushing. But that's not true. So the more we just get out of these boxes, really, and try to just be in tune with the present moment and what mom needs, and not rushing things, it's really good. Yeah.
Yeah. Waiting until your body says,
you can help push.
You're going to push.
Because this is the muscle that's really pushing that baby out. That's why people get popped blood vessels. They get so exhausted. The mother needs an IV. She's so tired. She ends up with a cesarean. Why? Because she's pushing when her body's not ready.
Yeah.
It's counterproductive pushing, and it actually exhausts the mother beyond anything. So, okay. Now I think we should review Running Start, just because it's so good. But I'm going to let you and Nikki do it, because Nikki's been in it at all. Nikki, I'm going to hold it. You guys are going to do, how about we do a scenario?
Okay.
Let's do a scenario with a breech presentation.
Excellent.
And how you're going to take care of it. And you guys can just go with it.
Here's your baby.
I like your blouse, Nikki. It's really pretty. It reminds me of Mary Magdalene. Because it's red. She's always red. She's always wearing red.
So
Doing so good. Would you like to change position? Sure. You're gonna raise a leg up. Which one do you like? This one. Okay, good. Oh yeah, that's good. Nice breath. Doing so good. Oh, it's coming. I can see the daughters are bulging.
So you're just not pushing, you're just breathing your baby out now. That's great.
Let me know. Oh, just hanging. Yeah. Everything's going perfectly.
And that's perfect. Yeah. Do you want to sit down or? So she's checking the pulse of the cord and it's pulsing. Yeah, I'll give you a blanket.
I'm just gonna put a blanket over you guys. So, keeping an eye on baby, on respirations. I'm not worried about baby breathing a lot at this point because the cord is pulsating and giving the baby everything the baby needs. I'm watching baby's color and it looks good. And I'm honoring this moment as mother picked baby up. And the mother is deciding when she picks that baby up. And the mother is deciding what she's doing with the baby. And I am just observing to be sure everything is good, that I don't need to jump in and do anything. Because the times that you need to interfere with that are rare. So please honor it as much as you can. Don't jump to a conclusion and be like, oh, we gotta rub that baby, it's not crying. Or just honor and wait and observe.
And mother and baby should be skin to skin.
Yeah.
That will help keep that
hormone cocktail. Absolutely, Nikki.
And a lot of times in a situation where you have people around, maybe dad, maybe a child with the mother, you're going to be saying encouraging things so that nobody else is jumping to conclusions and feeling like they need to jump in and do something like, everything's going really well. That's good. The baby's good. And you can whisper these encouraging things just to keep things calm as you observe that things are good and they are normal, so that no one's getting nervous.
Okay. Can we go through and have the placenta come out too? And
I have a question.
Sure.
So, a lot of what we think should be happening is, from movies or from hospital births or whatever, when they were used to hold them by their feet until, spank them until they cry. And, that is not something that we need to do to help this baby to breathe.
Yeah.
We let things happen naturally. And
we honor the sacred design.
Yeah.
And the imprinting, that sacred bonding, the imprinting, that baby is highly sensitive. So we want to really allow that. And also we want that for the mother to be able to bond, to be able to have the long-term bonding that helps with postpartum depression. It relieves so many issues with postpartum depression. That whole cycle of the baby imprinting with the mom, the mother imprinting with the baby, has been shown to reduce postpartum depression significantly. So I think it's really important. Thanks for bringing that up, Nikki.
In a low resource setting, if you were to try to emulate a hospital birth, you would actually be putting the mother and the baby at risk.
Which is exactly what they did in many, many countries where Robin Lim went in to try to fix things, where they were having a 50% cesarean rate in women. About 40% of them were dying after the birth because they didn't have proper facilities to help deal with infections from the cesarean sections. So I think it really is important in a low resource setting to do what Robin Lim does, where she has like a 2 to 4% cesarean rate, like I had for my whole entire years of practice, and has 100% breastfeeding rates, which is absolutely critical, and does 100% laid back breastfeeding with all of her clients, or all of her, women that she responds to in those post-disaster settings. She has probably 10 clinics all over the world. Her main clinic is the Boomy Sea Hut. You can go and look online to learn about Robin Lim and her clinics, but what we model these trainings after is her teachings.
Okay. So we're going to move into the delivery of the placenta.
Okay.
So I'm observing mom and everything is going really well. I noticed that there has been a gush of blood. This is the normal gush of blood, signaling to me, the observer, that the placenta has detached. And I'm going to ask the mom if she feels a little pushy. So do you feel a little pushy? Is that a little,
Yeah.
Yeah?
Yes.
You just want to give a little push if you want on your belly. Maybe if you could give just a little cough. Okay, yeah. And I have a bowl. I'm catching or putting into the bowl as it's slipped out. And I'm just going to set that off to the side. I'm going to be observing her bleeding at this point, but I'm not going to be making a big deal about it unless it is gushing out of her.
Should be a quarter of a cup.
We can do more.
Quarter to a half a cup is for the placenta gush. So that's already happened.
Okay.
And then now there can be up to 2 cups of blood is kind of your threshold.
A lot of that is going to follow the placenta out, especially if it's been sitting there a little bit. You will have formed some clots and things, and there'll be a little bit of blood that is built up. And as the placenta comes out, you'll have this bit of a bloody mess, and it's okay.
It depends on the mother. If a mother's really small and she's got a low hemoglobin and you know she hasn't been well nourished, she might even not be able to lose 2 cups of blood very well without having, and so you have to watch the mother. Like, is her face gray? Is she looking like she's fainting? If she is, talk to her, keep her there, and start dealing with it as if it is a hemorrhage, because maybe she's just got such a low ferritin level that she can't manage that much blood loss. And then on the other end of that, you'll have an obese woman or some really athletic, big, tall woman who's got like a high hemoglobin, and she loses 3 cups and you can't even tell. And she's acting like she didn't even lose any blood. And I've had both scenarios.
And it can even be the opposite. If you have someone who's used to having a really high hemoglobin level, and then they're losing blood and that's dropping, then they can actually have a larger reaction and be feeling more faint than someone who's used to having a lower hemoglobin level.
And if you suspect that a mother could faint, what would you do?
Well,
like right now, what would you do if you suspected that even a possibility?
If I see that she's looking a little faint,
Mhm.
I'm not that worried about the amount of blood loss, but I'm observing mom, and so I'm going to stay close. I'm going to be supportive. Maybe I'll be offering her a drink of water, but I won't be getting her up.
And I would actually be getting her flat on her back right now, because
So if
you don't
I'm
want to be
worried
sitting
about
up. Yeah.
then
Or even about fainting, because you don't want her fainting, even because she could fall over and then it'd be harder to manage.
Yeah.
It's always easier to manage anything like a faint when she's down. Yeah.
And laying down helps with the bleeding.
So let's get her on her back and let's just examine her placenta. I mean, let's examine her uterus and just see how it's doing. Just because, let's pretend it's a little bit more than you think you would want to see, just to review this.
So I'm just going to feel your stomach, okay? I want to see where your uterus is at. As I stimulate it with my hand, it firms up nicely. It's doing really well.
And you can even feel it too, Nikki, if you want to. Yeah. It's good to help the mommy know.
You feel that?
And that's a hard grapefruit right above your pubic bone and below your belly button, okay?
Right there at that level. And that's just how it should feel.
Good.
It'll go down over the next few days and weeks, but you just want that to be nice and firm.
And sometimes it goes to one side or the other. And what could she do if it does that, Nikki? I mean, Faye?
So you can kind of move it in and stimulate it. And as it gets stimulated, it's going to want to be centered.
What can happen if the bladder's full?
So if the bladder is full, because let's say she's spent, the last couple hours, she hasn't used the restroom, but we've been offering her water quite a bit. Well, because there's so much room in there now, she may not feel that she needs to pee, because suddenly everything's open with lots of room and that bladder can really fill up. There's no baby pushing on the bladder anymore, making her feel like she has to pee all the time. So if I'm concerned about her bleeding or fainting, I'm not going to want to get her up to go use the restroom. So I'm going to put down a towel, or I'm going to use a container, and I'm just going to have her pee right here. Say, I need you to try to pee, and I want you just to use the restroom right here. We have some things to catch it in, or a towel laid down. And so I need you to try and pee. Well, maybe she's so numb, the whole area can be a bit traumatized. And so she's like, I don't think I'm peeing, because she can't really even tell if she's peeing. Everything's been a bit, you know, you don't go through labor every day.
Can I mention a couple of tips for that?
Yes.
Okay,
so for some of the tips.
Well, I just want to mention just a couple of things that you can do that we've used, because when we were practicing midwifery, one of the things that was one of our protocols is that we would never leave a birth until that woman had peed postpartum. That's just, we always wanted to make sure that was working and functioning well. And that is one thing that you should make sure, is that if you're helping a mom, that she is voided after, and that you know that. And one of the things that you can do, because of the numbness and that big roominess that Faye's mentioning, there's two things. Sometimes just a drop of peppermint in the toilet, and that smell will help her go. Sometimes turning on the water, having her put her hands in the water can help her. Turning on the shower can help. And sometimes putting a half a teaspoon of cream of tartar in a cup of about that much water, and just having her down it. It's a doula trick I've learned, and it does work somehow. I don't know what it does, but the cream of tartar, I keep it in my kit. Okay.
And those are great ways to help her.
Yeah.
To pee, which can slow down the bleeding, help the uterus to clamp down. And as Char mentioned, you don't want to leave until she's peed anyway. Not that you would leave a woman who is bleeding, but
yes. Well, this is a very acute situation right now, where you're wanting her to void so that you don't have the pressure on the uterus. Okay. Well, that's perfect. Thank you so much, Nikki.
So even if she's still bleeding, you want to.
Well, yeah, if you can, because that could be causing it.
Yeah. The bladder can
definitely
cause the bleeding.
Okay, so let's go ahead and
baby was breech, and we didn't really even talk about it, but baby came out just fine. We didn't touch the baby as the baby came out. We just let the baby come out, which is what you're going to be doing anyway, unless there's an issue. So you are going to be doing all hands off deliveries. Yes. But you're not going to, oh my goodness, is that a foot? Ah, and freaking out. You're just going to be encouraging. Yes, this is okay. I know just what to do, and you're going to let it happen.
Yes. Perfect. Okay. Thank you, Nikki. Thank you, Faye.
Here, I'll take the baby for you.
Did we get this whole list gone through?
Yes.
Okay.
Of the long labor.
So yes. So I think just to review the breech, since we did breech, I'm just going to have Nikki review those, just because it helps to go over stuff more than once, I think.
Yes, it does.
Okay. So breech presentation is when the baby is sitting bottom first instead of head first. The baby can still be born normally. To help the birth run smoothly, do the following. Number one is to stay calm. 2, hands off. Do not pull, tug, or touch the baby. Try to keep the mother in an upright position. Leaning forwards on hands and knees works best. Allow the body of the baby to hang until delivery is complete. So it's okay if the body comes out and the head is still there. Just let things happen. Baby's back must be towards mother's belly. If not, when the legs are out, hold baby by the bones, gently lift upwards, and then rotate. Do not pull on the baby. So this would be like last case scenario, right? Yeah. So the legs are out and it's not in the, so that would be.
So you also want a warm environment for the baby. So
I think let's focus on the normal, because that other position is so rare. We're not going to worry about that right now. Okay. Yeah.
So a nice warm environment so that as the baby is out, it's a warm room.
Yes.
Okay.
And just assure the mom that everything is okay and that she's doing great. Have the mother avoid actively pushing until the baby is fully born to the umbilicus. Okay, do you want to explain why that is?
So as baby's coming out, no pushing, just encourage mom to breathe, breathe, breathe. And then once the umbilicus is out, then
she should push.
Then you want to be like, okay, yeah, now we can push, mom. Go ahead and bear down and push.
And having her in an upright position, but it could be standing.
Yes.
Could be
but
leaning over a counter.
Encourage her to push when she's not having contractions. It's just going to be okay, yes, push with that contraction. Let's get the baby out. Push with that contraction. Right. And one of the things I've noticed that a lot of people seem to be a little bit afraid about is delivering baby, breech or not, but delivering the baby and letting the baby fall onto the ground. Whether mom is standing, squatting, hands and knees, that baby is going to be just fine. You can let the baby just fall onto the ground. Don't feel like you have to have your hands on.
Because usually you're going to have a towel. You're going to have something there to soften it.
We're not going to put, shards of glass under there.
It's going to be soft.
We're going to have a squishy spot for the baby to land.
Yeah.
And it's okay. Baby's going to come out and be just fine falling onto the floor.
Yes. And always remember that the cord's attached. So you can't just necessarily pull the baby around anyway. You either have to put the baby, let's just demonstrate that, how you have to put the baby through the mother's legs. So say she had her, say you're on your hands and knees, Nikki, or you're on your hands and knees. And let's just go through a scenario. Let's go through a posterior scenario. Let's go through a full scenario. You're having a posterior baby. And you guys have to try a few things to get the baby out, okay? And so it could be, you could have to try multiple different things. I'll let you just think about the things you want to do.
So besides the rebozo and things that we've already...
You can do whatever you want. But babies, you're having a lot of back pain.
I'm having back labor.
Yes.
Hurts all the time.
Yep.
Contraction.
Even in between. Yep.
Let's try bringing your knee up and coming into a runner's position. Okay, and just move as you feel you should move. Does that feel good to put pressure?
Yeah, push right there.
Here.
Harder all the time. Oh.
Okay, move into that position. You're doing great. You're doing great. Okay, let's try moving onto this ball.
What am I supposed to do with this?
Okay, just lean on it and roll. Just roll whatever feels good to you, okay? Then I'm going to use this rebozo here. We're going to move this baby, okay?
Push on my back again. Push on my back.
Okay, talk to your baby. Talk to your baby. Move. You're doing beautifully. You're doing, baby. You're doing beautiful with this baby. Okay, here we go. We're just going to give you some shaking. Okay? Shake. Okay.
Yeah, right there.
Okay. Push. Okay. All right. Yes. Let's get them down. You're doing wonderful. So good. Okay, here's your baby. You are doing so good. So good. So good. Do you feel like you can lay down? So beautiful. You warm. You did so good. Even check if it's a boy or a girl. You have a beautiful baby. It's a girl. I always wanted. Congratulations. So beautiful. You did so beautifully. Good job. I'm really not that cold, but I'm shaking a lot.
Oh, there we go.
Let's get another blanket.
Oops, sorry.
There we go. Here, oh, seeing a little blood here. Doing beautifully. Doing beautifully. Feel like you need to push it off? I don't know. When you feel see, yep, here comes the placenta. Just go ahead and give it a little push. Just wound up here. Just gonna pull a little, okay? Oh, there you go. You did good. So good.
We'll put the placenta up right beside the baby.
Oh, right.
We always want the placenta even with the baby. We don't want it lower than the baby because it's still pumping blood into the baby, right? So beside in a bowl is good. Perfect. Do you want to, now she's not bleeding at all right now. So you don't really have to check her uterus right now. If you want to, you can teach her to find it so that she knows how to check it herself.
Okay.
So do you want to do that?
Yeah.
Because she's not bleeding, so there's no real urgency, but it doesn't help. It doesn't hurt to educate her about it.
Okay. So
Now I'm being more aware of what's going on around me, okay, and not quite so involved in the baby right there.
Okay.
That
So
would
how
be a
long would you
sign
suggest
that I'm
After the placenta is done.
After the placenta, you've had time to kind of have this moment.
Mm-hmm.
You can see that I'm interacting with the people around me a bit more.
Okay. Great. Okay, so now your uterus should be nice and firm, like a little grapefruit, kind of between your pelvis and your belly button. So when
You could even say, do you want to feel it, and see if you can find it? And she might say, no, you do it, or okay, or you do it together.
Okay. Would you like to feel down there and see how that's feeling? Show me. Sure. Sure. here we are. Just going to kind of feel that. Can you feel that nice little firm grapefruit? That is good. That means your uterus is contracting like it should and being right where it needs to be. So good. Good job.
Okay.
Wonderful.
I'm
Excellent.
thirsty. I'm
Hey.
You guys are awesome. You're awesome, Faye, and you're awesome, Nikki. Thank you so much. Okay, that was beautifully done, by the way. I actually get so caught up in those, I get emotional. I do. It's kind of special. Can I have you, do you mind holding it for a sec? Okay, I just want to check the time and see where we are on our list of planning, because I think we've covered a lot, but there's one more thing I want to cover on our list. But can I just have a check-in for time, do you know? Let's say.
It is just after 11.
Oh, we got a whole hour. We did well. We got a lot done in an hour, didn't we? Okay, and there's nobody here yet, so this is being recorded for other people. Perfect, that's fine. I think a lot of people work and then they go back to this. So we've gone over long labor, labor with malposition, long pushing stage. Another thing I'd like to mention on long pushing stage is walking up and down stairs. If you've got a good railing and some support, with big strides can be quite helpful.
Yeah, 2 steps at a time.
Yeah.
Almost like lunges.
Also, going outside in the fresh air, changing the energy can really be helpful. Like open the windows, go for a walk. Like, especially if you're in a room for a really long time, it's almost like there gets to be a staleness to the energy, and to shift it out, put some music on. See if there's somebody there that needs to get out of the room. Open the windows and get some fresh air and take her outside for some sun and some birds and nature to help her regroup. So there's lots of things you can do to shift energy with a long labor. And then we talked quite a bit about honoring the pause and not jumping into being really actively involved in the labor before true active labor.
Yeah.
Do you want to add anything to that?
Not really. I'm thinking maybe you could start going over the birth bucket, and I want to go check on Kevin.
Okay. Why don't you? Okay. My husband actually had a seizure yesterday. It was quite challenging. And you know something that I really learned. You're going to go check on him. Okay. Thanks, Faye. Something that I learned yesterday when I was dealing with that. It was very scary. My husband stopped breathing for about 15 minutes, and he looked like he was dead. He really did. He had to go to the hospital, and it was quite serious. So now my midwifery kicked in. I have to say, I did everything. I was like a midwife to him. I was just, and when they came and got him, I was able to just facilitate the whole thing without a glitch. You know, today as I was marveling back on that, thinking, wow, that's amazing. How I did that. How did I do that? And I realized it was because of my training. It wasn't because of any other reason than my training. And I realized that it's not just the experience, it's the role play and the drills and the scenarios. When you're working through those role plays, you're actually building muscle memory. I was on complete autopilot yesterday. I was on autopilot because I've done transfers, you know, I've done many transfers to the hospital. I've worked with the EMS, and I've also worked with emergencies. I mean, my husband it was interesting too, because I had the impression to go into his room. We sleep in separate rooms. We definitely get together a lot, but we have our own little spaces. And I went down to cuddle with him, but usually I'll stay for a couple hours and then I'll come up. But the spirit said, stay. So I stayed longer than I ever do. And there I was right when he had the seizure, which I think was combined with a stroke. That's yet to be diagnosed, but he has more testing to do. That's my experience with it, that it was like a stroke and a seizure together. But anyway, he's stable and downstairs. Faye's gonna go check on him. But what it did was it helped me realize that, like, I could be teaching you all this stuff and you're getting it all in your brain, which is, your brain is okay. It's good, but your body is essential. You need it in your muscles. You need it in your muscle memory. And that's when you can actually go on autopilot and not have to, you can be going through all these emotions, but your body will still do the right things, okay? that's why I'm going to suggest that you practice. Now, I want to show you that you get together with some people like what we're doing. Where's that little book we were reading?
Is it under
that little white book?
No.
Well, it seems to have disappeared.
Is it under here?
It's okay. I don't really need it. Now, why was that? Oh, the reason I want to show you that book, I showed it in the last video that we did. But basically what it is in there, we show you the roles. So if you have more than one person, for example, then you can delineate roles. One person could be the baby catcher. One person could be the person, what we call the doula, helping the woman with getting drinks of water, soothing, comfort, like pushing on her back. And then somebody else could go gather supplies. So, or create a privacy screen or whatever you needed. So those are some of the things for the roles. And then in there, we also have a whole bunch of examples of scenarios that so you read the scenario out loud, you get some of your friends together, you get a doll, put it under your, one person is the pregnant mom, one person's the baby catcher, one person's the father, one person's the doula, one person's calling 911 and getting supplies. You designate the people and you role play the scenario yourself so that you get the muscle memory. And so you could have like just gatherings of sisters, gatherings of women, gatherings of friends that you get together and you do these. That's my suggestion. Now I want to go over something here with you. And I want you to come close to me if you can, so that you get the sound to it. One of the things that I really, really do recommend, can't recommend this enough, is that if you're going to be helping women, if you want to do this, and there's going to be a massive need for this in every community in the United States and Canada, probably all over the world. Somewhere places it'll be more than others. This is a really nice pad that I love, that I highly recommend. You can get it from Medline online, but it's cotton on this side, very absorbent, and then waterproof on this side, and it's washable. So then that's the pad that goes under the mother. Now, if you had towels, and if you didn't have a nice bucket like this and all set up, you could use towels, you could use whatever you could to absorb the cloth or the blood and fluids, but why not go and get something like this? Or you could make something like this. Sometimes you can glean. Sometimes at hospitals, they still use them, some of them, and you can glean those. So I'm just gonna put that in there. Now, these are rubber gloves. How I learned about gloves like this instead of the regular gloves. Like you take a regular box of gloves, those gloves are so thin, and you're gonna go through, we could go through a half a box of gloves at one birth. I mean, because you're always taking them off. Now what we do, I learned this from a Mexican midwife who worked in Mexico where they didn't have reusable gloves. And they were doing births down there and they had to have sanitary. What they would do is they'd have a big bucket full of pine sol and water or bleach and water. And they would just wash the gloves and then dip them in these, they would wash their hands and then dip them in the bucket, and then they would go back out and continue at the same birth. Do you know what I mean? So they could use 1 or 2 or 3, and that would be all you need for the whole birth, right? There's your gloves. This is a thermal blanket. Now you could use this both on the mother and the baby, but mostly this is for on top of the baby. If you did not have anything to put on top of the baby when the baby's skin to skin, you could use this and it will keep that baby warm. It will, these work. Okay, especially if you're outside or you have drafts, or she's traveling, you could wrap this around the baby. And then you can actually, and all of this stuff we take in donations. So please consider donating. I do all my work as a trade for donations so that I can help moms. But these are slings that you make out of used t-shirts. And we have the pattern for these. If you want to email me, I'll give it to you. But you could wrap this inside of this, and you can actually use 2 of these slings, 1 on each side with the baby in the middle and this around it. And the mother could be walking if she had to. Like sometimes, you don't know, you might be having to flee or evacuate after a birth. You just don't know. So yeah, so we have these slings. I'll put 1 sling in the kit. I'll keep these other 2 sinks because we don't need that many. Now I have a disposable diaper in the kit just because, I mean, really it's only good for one time. But if you did do a birth, you could have the black meconium poop in there and those things will stay in your cloth. So I have one of those. And then we just have a little clothes for the baby. It's just a basic little outfit, a layette for the baby. This is a really important thing. It's called a family cloth kit. This is basically a separate kit from this, but we add it to this kit. This is the bathroom needs for the whole family, basically. It's got your squares. It's got your fills and after to wash the cloth.
Explain squares.
The squares, I'm going to explain the squares. And actually, this is the only thing I'm really taking right now is donations of squares. And that's what I really encourage anyone who wants to send them to me. Send them to 1892 Salem Pines Lane, Rexburg, Idaho, 83440. If you want to donate to me, I'd really appreciate that as an offering. So right now we're taking 8x8 and 12x12 squares because we find them the most useful and we use them for everything. They can be used at the birth. They can be used for the mother's bleeding after. They can be used for diaper liners. They can be used for wipes. They can be used for just the list is endless. Breast pads, yeah.
And the best fabric for them.
I really think that there's preferences with the fabric. I think flannel is good, but I also like the alternative of used t-shirt fabric. So that would be like those. The used t-shirt fabric is really nice.
So I put on one of the slings to kind of demonstrate. So it's pretty much, though this one is a bit nicer, it's pretty much just the t-shirt part with the arms cut off.
Okay.
So that if you needed to, you could rip one of these pretty easily. And if it was too loose, then you, as she said, you could use 2. Put one on the other side. So you just have it like this. One of the most important parts is to have it spread out over the shoulder so that it's not all bunched up and like pulling on the part.
Right.
So you have it spread out over the baby and spread out.
And you don't have the baby sucked down. You make sure that the baby's face is visible and not plastered on your breast because they have to breathe. And there's been some cases of babies getting sucked down and mothers not being aware. I don't know how that happens, but it does. Okay. I carried all my babies 35 years ago like that with a sling. I had a beautiful sling. Yeah. I used to go for long, long, long hikes. I mean, long hikes with my babies on. So, you know, you can get strong with them.
Can you demonstrate how you could use a family cloth for?
Yes, I will. Okay. So I want to show you, I used to like the 5x5s. And after I started doing it myself, which I have done, I have been doing this myself. I first want to go over the soap because it's bothering me and I'm going to get her to bring it up. Okay. 2 bars of soap. My favorite one is the Fells and After. You can also use Zote or Fells and After. You can get it at Walmart or lots of other stores. These are the soaps they use in Mexico. I've lived in Mexico twice and people wash all their clothes with these and they last forever and it's amazing. So yeah, for the future, these kind of soaps are amazing.
And you may have never seen the Fells Naphtha. So if you go into your local grocery store and you go down to the detergent aisle,
$2.
It's going to be hiding up there on the
and that thing will last 6 months. I'm not kidding you. It is the most economical way to wash your clothes. I washed all my clothes in Mexico with that in the river.
So that's not for human sanitation, washing hands and stuff. It's for washing your clothes.
But there is also another one in there for washing hands.
Okay. So you got one of each.
Very important too. Okay, and now I just want to say these are 5x5s, which was what I started with. But then when I used them myself, I realized I like an 8x8. I don't want any of my hand, especially for number 2. If you're spraying, which you are, you're going to be spraying with your bottle with your warm water. You're going to spray first. These are more for patting and just slight rubbing after you've got the water to get most of the fecal matter off so that these aren't full of fecal matter and they're easier. And then what you do is they'll get a little bit on them. And then what we have is we have a little bottle of a solution of vinegar water. So this is a solution of vinegar water that you can use to sanitize and clean things. And then this is pure Castile soap. And what we suggest is to put 1 drop in here, just 1 drop. And then when you're washing, you know, it's kind of cleaning. And this is really, really pure.
So this is,
Bronner's.
This is post-birth.
Post-birth. And this could be, you know.
So you can use the cloths for cleaning
use that
after
anytime.
post-birth, or just if you don't have toilet paper.
And yes, and then now these ones, these are the 12 by 12s. They're actually my favorite, the 12 by 12s. These are
Very
double
convenient.
ply serged on the edges. And like, for example, this kit, this is a kit from Mother. It's got, I put an extra pad in here just because I thought, you know, sometimes that initial pad for her, a really big one, is nice because those first few hours she can have more blood, right? And then in this one, all I have is these ones, and we just fold them accordion style and layer them and use pins to put them in. But now this one, we have, this is for the pads. A friend made all these for me, and they have like a basic like this, and then they have ones that you can stick in and make them thicker. These are nice because they're so long. But let's continue here with the kit. So what you do is you go to the bathroom, you fill your thing up, you put your 1 drop in there, you spray. I find it takes 2 of these to really clean yourself properly. So the second one maybe is just water to rinse. And then you're gonna pack, and that's it. And then what you do though is you take your soap and you wash it right away in the sink. So you're not like throwing it in a bucket to stink or get kind of set. You quickly wash it. And that's why we have a face cloth for the mom, or a little towel for the mom in here to wash her, to dry her hands off when she's cleaning her hands and stuff. And then we have the paracord and these, so that right in your shower, you can just have a little clothesline and hang your family cloth. It's dry. Then you just throw it in the washing machine with your regular laundry. Okay, that's how that goes. And now let's see. Anyway, I'll let you put these back in here.
When you aren't in the situation where you can do washing right away, you can have a bucket of water that you would then just put it into the bucket of water and have, you know, if it was the mother and she's, you know, maybe she bled too much, she can't do it. She just places it
like
in a
you would
bucket
a
of
diaper,
water.
kind of like you would a diaper. If you had a bucket for diapers, you would have water with washing soda in it or vinegar or something, right?
Yeah. And
that's a really perfectly good idea.
A clean plunger to actually plunge and clean.
What a good idea.
Those, and then be able to put them into the.
What a great idea. And speaking of diapers, you know, I recommend having cloth diapers. So this is just a small sampling. These are just inserts that go inside these. So we have 2 with inserts, and then we have extra inserts. And then we have prenatal vitamins, toothpaste and a toothbrush, and we have a power bar, or electrolyte powder, so that she can get, and then food bars so that she gets fed. After the birth is really important for the mother to eat, and even during a long labor. Like, I mean, we talked about long labor today, but that's one thing we did not talk about, is if a mother really gets fully, totally exhausted, there has to be a way to keep her not only hydrated, but nourished and keeping her blood sugar up. If you've got to go, and if you've got to like take some, you know, tahini and mix it with honey and spoon feed her during the labor, whatever you've got to do to get a little bit of nourishment into her body, so that she's not just running on empty. And keeping the fluids up too, and electrolytes can help. And that coconut water can be good, I think, during labor, if you have it. Coconut water has been a good choice that I have found has really helped women stay hydrated. The other thing, I know I don't recommend to do interventions very often, but I do recommend, if a woman is dehydrated and she's got like kind of loose skin turgor, she's exhausted, she's been puking, say, and she can't keep anything down, and you happen to be helping her and you have an enema, I think having an enema set in your preparedness bag is a very good thing to have, and knowing how to use it.
You will save lives with that.
You will save lives, you will reduce suffering extensively. It is proven that it reduces suffering to release the bowels. So, you know, you may release the bowels, but you also, what you will do is if you have her in a knee chest position, and you could just put some diluted molasses water or something into her, in her rectum, her soft tissues will absorb the minerals and the sugars and the water, the fluids, and it'll instantly give her energy. You'll notice she'll just, if she stays in that position and she can hold it quite long, she'll absorb a lot of it. Then she'll let the rest out, and that's okay. But it'll give her a boost. And it also stimulates the uterus, so it gets contractions going really well for a person that's not getting going. And there can actually be bowel blockages too, which can cause inhibitions to labor. In certain cases, I have seen that to be true. So, I mean, the old days, they used to give everybody an enema. We don't do that. It's kind of invasive, very invasive. But it doesn't hurt to know how to do it. And that might be a choice that you might choose if a woman is, say she has been constipated and she knows she is, and she just feels like things aren't progressing, and she does an enema, or, you know, just a low enema, and warm, always do an enema warm, because your body's going to reject cold water in there. It's not going to like it. And plus you want to be as tender and sensitive to that woman. Use a lot of lubricant, and make sure you know the angle of the anal sphincter so that you're putting it in properly. But I mean, that's kind of, it's not that high tech really. I mean, as lay people, we should know how to do enemas in our families. Okay. Yes. So does that answer all the questions about the kit?
I think so.
And the bucket is such a good receptacle. I also want to mention two things. One thing is that I love wool. I think wool is really helpful. I love it when, you know, we used to buy sweaters, so pure wool sweaters, and then wash them in the washer and dryer, and then you basically shrink them. And then you can make diaper covers and breast covers. Breast covers are really important, especially if you were helping somebody and it was cold and they were having to travel. So they're not getting all wet and their breasts aren't getting cold. Wool will wick the water, and it will actually keep the breasts warm even if they're wet. So wool breast pads, wool diaper covers, I think are really good investment. And then I really like these lids. Like, I think investing in a good lid, because when you want to get this lid off, you do not want to try to get that lid off the normal way. I'm telling you, it's not easy, and you're going to be in a hurry sometimes. So these little twist lids, I say they're worth their money. That's my opinion. Yeah. Okay, so that's our emergency childbirth kit for you to view. I'm going to take a little drink of water. Here. Mm-hmm. All right, now we're going to go back to our plans here. Does anybody have any questions or ideas what they want to discuss? Or
I think it was really important to remember to just pray and be open to the Spirit guiding you, because angels will be attending the birth. And it's so important to remember that, and to remember that there's divine help. And especially if you are new at this and you have a situation come up, you're not going to be able to remember everything unless you're asking for help.
I think that's really important, because like people will be taking notes when I'm teaching these classes, and I think you're not going to have those with you, you know, necessarily, and you're not going to have the time to try to figure it out. Really, the best thing you can do to retain this knowledge is get some friends together, you know, either get my book or create your own scenarios, but you're going to need some guidance probably. So the little book is really good. And, you know, get together and practice. Get the muscle memory going. It's so vital. I want to just read a couple of things that I feel guided to just mention. The one thing we haven't talked about is the pelvic floor health. Yeah. In pregnancy.
That's the last thing that you're
yeah, so I want to talk about that. I think really remembering that fear is kind of, it's not your enemy, but it's an indicator that you need to refocus. You know, if you're starting to feel fear, at the beginning, when my husband was first doing that, I tell you, I did have a little bit of a big reaction at the beginning, until I had to actually calm myself down. And I did self-talk. I did positive self-talk. I connected with the angels. I tried to see it from a bigger perspective and to look down upon it from like an angelic perspective. Like I try to imagine what the angels are thinking as they're watching us. It really helps me. I do. I visualize them, and then I don't feel alone. And I just feel this kind of like this sacred, tangible quality of kind of ethereal goodness all around us. I felt it the whole time there. Yeah. Okay, so now what are we doing? We're talking about pelvic floor health. Okay. Well, we did mention it a little bit with position, with how your posture is really important. Now, another thing about pelvic floor that we should mention though is like you have a muscle here, your diastasis rectus muscle, and it's supposed to be relatively closed or just slightly open, maybe a half an inch at the most. But what happens is it spreads during pregnancy, depending on the mother's posture, her routine ways that she uses her body and moves her body. So we're going to show some.
And genetics.
Well, let's say genetics. Okay. Genetics. And also I think it has to do with diet too, don't you? Like there's something in there about that. Genetics always plays a role in everything pretty much, I think. Thank goodness I had good genetics. My mother, she had 9 babies and she had us all pretty well fast. And I had some amazing births. I love my births. So beautiful. It's so beautiful to watch these guys act so realistically because I've seen a lot of birth and it's real. This is real. This is really how it is. It touches me deeply to watch them act it out because it's so sacred. It's a holy place. To be at a birth is a very holy place. And so, but one of the things that we want to do is to talk about how to get up and down. I think getting up and down from your bed or from any kind of laying down position, is a very key element because you can do damage, So like we're used to, in our society, we're used to sit-ups. Sit-ups are actually not good for women. So you'd be very careful about sit-ups unless your legs are like on a chair and you're really, really careful.
Yeah, sit-ups can actually make
it
worse.
Wider. Yeah, they make it wider. So really we say no direct sitting up like this. So what you're going to do is you're going to roll.
Encourage the mom to roll over.
And every time you do an exam on her belly, you help her remember this. She's pushing with a hand, and I'm going right over like this. I'm using my hands and my legs. I'm not using my stomach muscles at all to get up. Okay, that's the key. Anything else for that to make sure that those don't get
It always bothers me because the doctors always offer me their arm. And you feel like you have to take your arm to get up, but it's in the way.
Yeah, it's not really. Yeah, it's not really the thing you need
up.
is an arm.
Yeah.
You need them to just say, you can do this, and I will make sure you don't fall while you're doing it. And so, it's just a reprogramming. And, sometimes you might have to say, it's okay, I got this, or whatever. I think being really, really careful of exercise programs and elliptical trainers or any kind of machines. I don't recommend machines during pregnancy at all. I don't recommend going to gyms and working on machines. I think it's not healthy. I think it affects the body and the pelvis and the knees in negative ways because you're on a machine. You should be on the earth if you're going to walk, even walking on a sidewalk. If that's the only thing you've got, then do it. But if you can get on the grass or on the dirt or on the sand or on the beach or on a trail, please do so. Because being on Mother Earth it's basically an upgrade to your molecular electronic frequencies of your body will refrequent. Their frequencies will upgrade with Mother Earth. Right now, she's vibrating at a very high frequency. So if we stay inside all the time, we're not benefiting from her. That's one.
And it's strengthening to have the variation on your feet and the softness.
And your hips. It's actually hard on your hips to go on a hard surface all the time. It doesn't help the hips. Walking on a beach is really good for your hips. So a mother getting out on the dirt every day if possible. And then, like we said, no leaning back, not long drives, not going on long trips. Like I would really discourage moms from long trips. Another thing was working, sitting at a desk, sitting at a computer. That's a masculine energy. Get into feminine energy. Feminine energy is gardening, dancing, playing with your kids, laying on the floor, wrestling with your kids or your husband or whatever. just doing meditation and prayer and pondering and being in solitude or whatever you're going to do. But those are some really healthy things that you can do other than the reclining. Do you have any other ideas?
You had mentioned actually crawling.
Yes.
So why don't we move on into some crawling?
I've been crawling, like literally, I'm not kidding you, literally crawling. I would have women crawling for 15 to 20 minutes. So you put a movie on, you go in the living room and
Nice
you just,
carpet.
yeah, you do it on your carpet and you just crawl. And that becomes one of your patterns. You don't sit on the couch to watch movies. And then even then, you might lay on your side, you might forward lean on something, or you're going to sit up straight, whatever you're going to do, but you're not going to be like this watching the movie. Okay. I have to learn this too. Trust me. I'm implementing these things as I'm learning them, because I had a pelvic injury with an accident, and that's been a very big challenge for me. So yeah, pelvic health for women is probably one of the number one things that you need to be conscious of, because as you get older, your pelvic health, it becomes even more valuable to you as you realize the things that can happen with either a prolapsed bladder, a prolapsed rectum,
Or just incontinence.
Just incontinence, you know, and so you don't even know why.
You don't have to
have
live like that. You can do things to help prevent, maintain.
I think exercise, don't you? I mean, I think good quality activity without the sedation of
right, and not, it's not running and the jarring,
not running,
of that. That's not
jumping or running or anything like that. No.
But actually, yoga and things like that, those stretching moves can be really nice.
Gentle Pilates, yeah.
Yeah, and as you take advice from people and you start doing those things, start listening to yourself as well, as those things are just getting you to the point where you can then take the lead.
Yes, and I just want to mention something about that. You know, yoga originally was designed for men. So we have to realize that anything that's rigid, that's all set, and that's structured like that, that's masculine. I think a really good thing to do is put music on, get a space, and just get on the floor and start rolling around and making your body, you know, move the way you feel that you want to move. Dance.
Right. Dance is wonderful.
Squat, you know, squatting. I think squatting is a really basic thing to do during pregnancy to help your pelvic health. I really do. But to learn how to squat properly, like I like these little things because they can give you a little bit of support while you're keeping your feet flat. So like the idea with squatting, technically, is that you keep your feet flat. See, she's doing it. See, she's practiced a lot. So if you've got to get over here to see her, you've got to get over here to see her feet. How her feet, see, I can't even do this. You see how her feet are completely flat, but her bum's right down here. This takes practice. You will find that if you've never done this before, it won't happen naturally. Don't give up. You may have to practice for a whole year doing this, but you may not even have your feet on the ground at first. It might be you have to hold a table or you have to have something behind you, because she can do it on her own.
And this is something that a lot of midwives will recommend that women practice doing while they're pregnant, so that in labor you can do this and maintain this position for hours. You can, and you could do your gardening in it. You could clean up your floor. You could put your vegetables on the floor and trim them with that. You could, you know, deal with your babies in that. You can do a lot of stuff in that position. I'm still learning and developing my pelvis to the point where I could do it flat-footed without any support. So I still need support, but she doesn't. So it doesn't matter where you are. It's just that you keep working at it until you can get this flat-footedness, because that's the key to the proper angle that you need. And then I'm easily able to go forward and stretch, go down to knees, and then start the cat.
Cow. I find that very helpful.
That letting
That's very good.
Just hang and just kind of let yourself sway and move.
And any kind of sort of
stretch up.
Yeah, changing of the hips like that. That's beautiful. Yeah. That really, really is a good one.
And it feels very
Amazing.
nice, and it really helps baby.
It nourishes the baby.
Position.
It nourishes your whole body. It gives oxygen to the area. You're getting your spinal fluid is starting. You're pumping your spinal fluid up to your brain, so you're going to get euphoric experiences doing that. Mm-hmm. It's all good. You know, these things are good. These stretches. I think just trusting your body and doing the stretches, and not necessarily thinking you have to go to a class or follow a program or do all these fancy poses. No. You're just going to do simple things that help. And then you'll start noticing that feel good. Mm-hmm. Okay. And then postpartum, I think, well, with your stomach muscles, I think that's another thing in postpartum is just to be extremely vigilant with your stomach muscles, that you don't lift heavy loads, and just remember, pushing and pulling are the same as lifting. So if you're pushing anything or pulling anything over like 5 pounds at the very beginning, it's too much. So you shouldn't really be doing a lot of work. That's one of my things that I teach, that I really believe in, is that women need a 40-day sabbatical after their babies. And my foot's buzzing right now, so I know it's true. This is a custom from the ancient Jewish tradition that I believe is absolutely essential if we're going to have women that aren't totally depressed and having issues with all kinds of things. I think one of the reasons women have all these issues is because the divine feminine of allowing women to just be, where there's this huge narrative of high expectation for them to be doing. I mean, women are going back to church after like a week or 10 days. And it's, I just think, no, you keep your baby away from other people. And I've always believed this. I don't care if there's a pandemic or not. That baby should not be in a big crowd of people. That baby is vulnerable. So you keep your baby home, you stay home, and you rest for 40 days with your baby, and everybody does your work for you. In the Indian culture, East Indian culture, they paint your hands with a special henna paint, and you're not supposed to you're not supposed to work until it wears off, which takes about 6 weeks. So we need a few little traditions in our culture like that, I think. Gives women permission to recover, you know?
Yeah. And in our culture, because we don't have our support system set up, so let's all work on that. Yeah. But that means for a woman, if she's trying to take her 40-day sabbatical in our culture, it means isolation. Right. It doesn't mean help. It means I'm all alone and I haven't seen anybody except, you know, that first week when people were coming over to see the baby or drop off some food, and that's it. Where what we need to be able to do is to support those women, bring the socialness over. Like, how are you doing? I'm so glad to see you, baby. So beautiful. Look at those cheeks.
I just want to talk about it a little bit. I just want to talk about my birth. Will you listen to me? I would love to hear
all about it. Even though I was there, I'd love to hear all about it from your point of view.
I'll tell you, this is a really big thing. Women need to debrief their births. If anything that we go through, like my daughter and I talked for like an hour last night, and she's like, Faye, she knows how to let you process trauma. And when you're done, you just feel like it's gone and the trauma's gone and it doesn't have a hold on you anymore. So I was really glad I was able to do that yesterday. But one of the things is just to allow the person to kind of frame their birth in a way, even if stuff happened that they didn't expect, or even if there was, you know, because lots of times there's all this stuff and it was not quite what they thought, and they have to regroup it and put it into some kind of order in their mind and in their heart. And that can be the one thing that they need, is just someone to talk it out with them and mirror back and validate with eye contact. That can reduce postpartum depression right there, you know? Yeah. Especially if it's this beautiful, lovely lady with her eyes so glowing and beautiful. Okay. Well, I think we've talked about that now. Where are we with our time now? We don't have questions today, so it's definitely not as busy as when we had a bunch of people. We had a lot of questions.
11:47.
I think we'll just do our closing circle. Okay. Unless anyone has anything to add.
I have one more thing to say. Sure. I'm not a year and a half out from my last birth yet. And because of the separation and the stasis,
I'm conscious of that. And I'll find that if I'm not mindful as I'm doing things, you know, whether I'm laying down and getting up, that I will be pulling that apart still and make a separation. But if I am mindful of it, I'll pull that in and then I'll do what I was going to do. And that, you know, strengthens that area. I'm an older mom. I know you can't tell.
So well maintained and beautiful.
But just being mindful about those things and not in a way where I'm going to fix this. I'm going to take charge. I have this regimen. I'm going to, you know, do these sit-ups. I know a lot of women have done sit-ups to try to fix that and have made it a permanent issue instead of having it go away.
I want you to lay down, if you would. I'm sorry, when you're done. Are you done?
I'm done.
Well, I was just thinking, are you willing to let me show how to tell if somebody has one?
Yeah.
Okay, sweetie. Okay, so what I'm going to do with Faye is I am going to walk across her belly, okay, and come really close. I'm going to walk across her belly, and I'll show you how I'm going to tell. I'm walking with my hands, okay? Now, I want you to give me just a slight little rise in your head, not much. Okay, now. Okay, there's the end of her.
One side.
There's the end of one side right there, and there's the other side. So she's got about a 1.5 inch separation. Not too bad. Is that less than what it was originally? Was it a lot worse?
It was.
So it could be like 3. It could be like 3 or 5 inches.
Yeah, and it's just I'm allowing it to slowly come back together, and I will tighten it up, and then I'll come.
Yes,
as opposed to just pass it in.
Yes, and so when she rolls over and does her cat cows, she's actually, when she does her cat cows, she's actually strengthening these muscles right here.
It feels so nice.
It does. Oh, I love the cat cows. Okay, so I thought maybe I just wanted to show this picture since I brought it out today of Adam and Eve, and Eve's pregnant. And when we used to teach our classes in the bigger groups, we used to talk about Eve in a story. We would read a story about a mother who was very afraid and she didn't know what to do. She was just having a really difficult time at her labor. And suddenly the idea came into her mind that Eve was the mother of all living, and that wouldn't she be at every birth? And so she suddenly just had this glorious confirmation from the Holy Ghost that Eve was present there and that she did attend every birth. Spirit's witnessing it right now to me. I know she attends every birth. So there's never a fear there that needs to be joined into. Fear is a thought form. We can attach to it or we can let it roll by and feel what we choose to feel, which is faith, peace, calm, and understanding. Just like Eve, she had to step in some unknown territory, into some unknown territory too. And she did it with willingness. She had to transgress a law to obey a higher law. And I feel the Spirit right now. Eve was a great woman. She did nothing that was wrong. That was a myth. So we honor her today. We honor her. And all the ancient women who are teaching us by the Holy Spirit. And I say this in Jesus' name. Amen. Okay, let's have our song. Should we just sing our song again? Because we're just getting to know it.
You want to do that one?
Yeah.
It's a lovely one.
I do. I love
Let's
it.
do it.
What happened to it though?
One of your papers.
Okay. All right. You guys want to see it? Here. Sing along.
We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun. We are sisters on a journey, singing in the sun, remembering the ancient ones, the women and the wisdom, the women and the wisdom. We are sisters on a journey, watching life unfold, sharing warmth of heart and hands. The knowledge of the old, the knowledge of the old. We are sisters on a journey, singing now as one, shining through the darkest night. The healing has begun. The healing has begun. And since Nikki's been so good to record this, I'm asking her to say the closing prayer. And let's cuddle up together and hold hands. I love you guys. You're so awesome.
Our Father in heaven, we are so thankful for this time to be together and to teach and practice these things that will be so needed in the future. And we're so grateful for thy spirit and for thy help in guiding us and helping us to know how to move forward and to teach these things. We're grateful for technology that helps us to teach over long distances, and pray that those that will review these things, that these things will settle deep into their hearts and minds, and that they will have a desire to practice and learn these things and be a strength to those mothers that will come in the future. And we're so thankful to have the Spirit to guide us, to know that we have angels and our heavenly parents looking over and watching over us. And we are so blessed to have knowledge of thee. We ask for thy Spirit, Father, to be upon this world, this earth, that thy work and thy presence will move forward upon it, and that we can be a part of that work. We love thee and ask for these blessings now, and do so in the name of thy beloved Son, Jesus Christ. Amen.
Amen. Thank you, Nikki. Do you have any closing remarks, please?
I just want to thank everyone for coming and for learning and being open to things like this. Thank you.
Oh, I'd like to say a final word too. I just like to say that I think it's a really neat thing that you're doing to come and learn this, because I know there's a lot of distractions in the world right now, and that thinking of the future and thinking of helping other people and preparing to help others means that you're kind of organized in your own life and prepared in your own life, and that you have the energy and the capacity to take in more information and knowledge to help others. And I just want to say thank you for that. And I do want to encourage you to get your supplies. And if you go on my Facebook page, Charlene Campbell, Call on the Midwife, you'll find the list there, so you can get your own kit together and be really prepared physically, mentally, emotionally, intellectually, and spiritually to assist the sisters of our future with the births of their children and their childbearing cycles. And thank you, Nikki. Thank you, Faye. And God bless everyone. Thank you for being part of our circle today. Thank you, everybody. Nikki. Yeah, that's awesome. You're such a good actress, too. Oh, goodness. I was kind of like amazed today how good of an actress you are. Like,
really?
Yeah.